So this is a very interesting case that I'm going to show you right here. This is a middle-aged male patient who had a very simple ear infection, pus discharge coming from the ear on the left side for six months. He had this issue, and then he started having headaches on the patient's left side, temporal area on the head. So we got the CT scan done, and to our surprise, we got this finding. So this is the patient's left mastoid, which you can see on the screen right now, and that's the brain up there. So usually the mastoid and the brain cavity is separated by a layer of bone so that it prevents any ear infection going into the brain. That's the right, which is normal, and that's the left, which you can see there's actually no bony barrier between the mastoid and the brain. Because of the infection, the bone has undergone destruction. So what I can show you on the MRI scan over here is that on the patient's left, you can see a huge involvement of the patient's brain. Now, this hyper intense white structure, you can see that's the patient's mastoid, the ear infection. And this huge area which you can see right here is the patient's brain, and that's the inflammation in the brain. So initially the infection behaves as inflammation in the brain, and then it further progresses on to become a small abscess, which is a forming abscess, then a huge abscess, and this is how the patient lands up unconscious, loses consciousness. So the patient here requires an urgent intervention through surgery.